Good afternoon, everyone, and welcome to this AHDB Dairy webinar. I'm James Haig. I'm part of the Knowledge Exchange team for AHDB Dairy, and I'm joined by renowned vet James Breen from the University of Nottingham. Afternoon, James.
Good afternoon. Hi, everyone.
Just before we start the webinar, just a few points of housekeeping. Just to let everybody know that all attendees are muted, so please don't try and unmute yourself. Obviously, this is a live webinar and it will be recorded and available for people to watch on YouTube afterwards, as are all of our webinars. If you're registered with DairyPRO, please provide your name, your farm name, postcode and DairyPRO number into the message box, and we will make sure that your points are allocated to you. And throughout today's webinar, please do fire any questions that you might have to James or I. Discussion is very much encouraged. If you want to ask a question, please type it into the message box throughout the presentation. We're going to endeavour to answer all of these questions in today's webinar, but if we don't get around to answering any questions, then we will email you with a response once the webinar is over. Just to reiterate that these messages are private to James and I only. We won't mention your name, so don't worry if you think that you've got a silly question to put to us. As I did say earlier, all of our webinars are being recorded at the moment. You can find those on our AHDB Dairy channel on YouTube, and we're also producing many interesting podcasts, which you can also find on your podcast provider. Today's webinar is a quarter review for Mastitis, and for those people that attended the QuarterPRO workshops when we were able to meet each other face to face earlier on this year, will know that understanding how regularly monitoring mastitis data can help to reduce incidences on farm, saving you time and money. As I say, we're joined again today by James Breen, who was delivery for some of those QuarterPRO workshops. And James is just going to today give us a bit of a recap as to the importance of monitoring data, a bit of an overview again on QuarterPRO, with some examples from real farms, and also looking ahead to the pinch points that we might experience in terms of mastitis with winter housing coming upon us. So, James, I'd like to pass over to you. Thank you.
Thank you very much, James. Right, so good afternoon, everybody, and thank you very much to James for inviting me on the call this afternoon. As James said, it's my job to provide this sort of fourth quarter update, as it were, with QuarterPRO, and tell you a little bit more about it and where we've got to. So just for those of you who perhaps are not familiar with what QuarterPRO is, this is a national scheme designed to help with mastitis control on farm, and it was very much designed from the point of view of being able to allow you, the client farmers, vets, advisors, to rapidly assess the mastitis pattern on farm. We'll talk about what we mean by the pattern shortly. Provide you with some resources to tackle new infections and go back to sort of prevention, and be very accessible. Let's say farmers, vets, advisors, very much as a starting point for mastitis control. And we launched this QuarterPRO scheme back in February 2020 at Dairy Tech in the UK. This is our third webinar, if you like, so our third little get together, as James said, since the original roadshow meetings at the beginning of 2020 in January and Feb. We had a webinar in May, a meeting in July, and now this one in November. So really a quick recap, divide this session into three: a quick recap on what QuarterPRO is and how you use it, for those of you who perhaps aren't so familiar, some thoughts on using QuarterPRO to underpin mastitis monitoring through the year, sort of various scenarios you might find it's very useful, and looking ahead to winter housing and mastitis control. And like I said, we started this at the top of the year with groups of you, didn't we, everywhere between Cornwall and Aberdeen, using your data to look at the mastitis pattern on your farm. We even had an illustration in the summer with Willie Bailey up in Scotland, one of the strategic farms where we'd used QuarterPRO to help us as part of mastitis control with Willie. So very much bringing these together as we end the year and end, if you like, this fourth quarter. So in your herds, and if you're on the call thinking, right, well, you know, I'm a dairy farmer and I think about mastitis control, in your herds, the aim of this QuarterPRO is not to focus on cows that are already infected. I think it's really important we get that from the off. This is not about treatment. This is not about treating infected cows. These cows will cure during the dry period. We know that. Very good research evidence to say that the majority of infections will cure across the dry period, particularly with antibiotic dry cow therapy. So therefore, we focus on where new infections come from, and that's what's our focus. So in order to do that, we need milk recording data and clinical mastitis data to put together some sort of pattern. And I keep talking about this pattern because the first thing we have to understand is whether infections causing the predominant pattern, if you like, in our herd arise during the dry period when cows are dry, or during the lactating cow period when they're in milk. Because as you can understand, the control measures will be very different depending on whether we're predominantly focused on the dry cow and dry cow management or the milking cow. So therefore, quick recap of the scheme then. Like I say, some of you are more familiar perhaps than others with what QuarterPRO is and where you get the stuff and how you use it. So a very brief recap. If mastitis control is often perceived as simple, which it can be, and fundamentally I guess it is, we know infections will cure during the dry period. So therefore, it's all about prevention of new infections. Where do these new infections come from? We talk about these new infections coming from other cows, don't we? The sort of transmitting from an infected cow to an uninfected herd mate, what people call contagious mastitis. And we tend to think about this first sometimes perhaps, and we think about treating high cell count cows or culling cows with mastitis because we think mastitis is somehow spreading from one cow to another, and we end up talking a lot about treatment. Of course, for the vast majority of herds, particularly in the UK, we know that 90% of herds will have predominantly environmental mastitis infection patterns. So it's not a cow-to-cow spread thing, it's much more environment to cow. And this can be a real challenge because we're talking about bedding and yards and paddocks and gateways and ventilation and loafing space. And we're trying to keep a lot of these things under control. It can be a real challenge. So in order for us to focus, and this is really important, we can't do everything at once, we need to understand the pattern. In order to do that, we need your individual cow cell count data. And yes, unfortunately, if we're going to do any kind of targeted, if you like, prevention and control, we do need data to understand this. Fundamentally, I would like to know about cow 2240, there she is, because her cell count data tells me that between the 7th of May, when she had a cell count of 20,000, and the 11th of June, when she had a cell count of 3.1 million, she's clearly become infected. Now, I don't want to treat cow 2240 with antibiotic. I'd be running around treating high cell count cows every month. It just wouldn't get me anywhere. What I want to understand is, are there more cows like her? How many of them are there? I'll always get some, but have I got it under control? And actually, is the period between May and June a problem? Is there a pattern to it? Do we always see a rise in new infections at this time of year? This is a new infection in lactation, clearly. And I also need something about clinical mastitis event data, don't I? I want to know about cows like 673 in the middle of the screen there. She's been detected and reported with clinical mastitis, and look, she's 6 days in milk. So that is very likely to be infection she already had prior to calving. She's calved into the herd and she's got mastitis very quickly. And I could start to count how many times this happens, and I could color them in blue. And I could say, well, isn't it interesting? In most months of the year, I get a lot of new cases in cows that are less than 30 days in milk. Actually, in this herd, I might be thinking about dry period management much more than I'm thinking about what happens to my milking cows. So this is what the QuarterPRO scheme is built on, if you like, this fundamental looking at individual cow cell count data and cow mastitis event data. Because if we have this sort of thing, we can start to put it together and come up with a pattern. So QuarterPRO fundamentally is a three-step process. Step one is somehow predicting this pattern, and the group has come up with this novel pattern analysis tool, a little decision support tool. We therefore react using resources. If we know what the predominant pattern is, and I say predominant, we then use the right resource material to come up with some simple solutions that we can try and put in place to then optimize control. And 3 months later, we're going to review the pattern, we're going to review our resource material, and we're going to keep going. We're going to see if we're getting anywhere, as it were. Is the pattern changing? So just to briefly recap then, step one, talked about this data. Where do we get it? Well, for those of you on the call that milk record, you can go to your milk recording organization, and they provide something called a CDL file. This is our first point of call. We need to go to CIS, NMR, QMMS, all three will provide you with a CDL file, which is all your data electronically. And we can take that data, download it, and we can use the first of two free softwares. So these are softwares free to use at the point of download. The first of which is a converter tool that takes your milk recording CDL file and generates all these bits of data that we need to understand our pattern. I talked about how many cows become high cell count, for example, in lactation, how many cows develop clinical mastitis in the first 30 days. This is what this converter tool will sort out for us. And if you can stand the excitement, there's a little YouTube video that you can watch at this link here that'll explain how to use it. Please remember the importance of the clinical mastitis events. I realize that for some of you on the call, you might not share your clinical mastitis data with CIS, with NMR, with QMMS, but it might live in a diary, in a spreadsheet, on some farm software. Your vet might bureau this data for you. We need to get it out of the sheet and into some sort of electronic format. And for vets and advisors on the call, please do help. You can take a picture of the diary with your camera phone, type it rapidly into a little spreadsheet template. We can provide this for you. We can either extract it straight out of farm software, so if we don't want to go typing in and off a diary and it already exists, so for example, in Uniform Agri, this picture is here. This is often easy to do. Extract this data. If we're not sure, we need to learn how to do this. The clinical mastitis data is key with all this. The CDL mastitis data converter, this little tool we've downloaded, allows us to put mastitis events in if they're not already contained within the milk recording organization database. So we know, we say, look, we don't tell the milk recorder this stuff. We can merge that mastitis data in, and then the converter tool will let us generate an output file that has 18 months worth of mastitis and cell count data in it. That's what we want to get to. Once we've got that, we can move on. If you find actually like this herd here, they've got everything in C21, dairy plan software C21, well then there's analysis software like the Total Vet software, which will generate all this data for you straight out of a backup of on-farm software. But whatever we get to, we have a sheet of data, a sheet of information that we can then move to the second of our free downloads, the pattern analysis tool itself. So we download this second piece of software freely available, and this then accepts this data we've generated from our milk recording organization and from our clinical mastitis events. And again, there's a little YouTube video that you can watch to help you do this. It's worth saying if you're having problems downloading or installing the software, and some of you do get in touch to tell me that perhaps it's not working with Apple Macs or whatever, please do get in touch with QMMS or with Summit. They will help you import the CDL converter and things like that. Okay, having got our pattern tool, we can then import the data we've just generated, and at the touch of a button, we can layer in all our cell count data and all our clinical mastitis event data into the pattern tool. And this is really important because we can't hope to understand where to begin with our control measures unless we have our own data to look at going back at least 18 months so we can see a pattern in our data. The pattern tool will check the quality for you. Perhaps we're missing mastitis events, or we're missing milk recordings, or of course in this herd they go through a period, as you can see there in the middle of the screen, where not many heifers are calving in. So we might just take that period of time with a bit of pinch of salt. But then the pattern tool gives us an output. And very briefly, it's a traffic light system. It's a relative contribution based on some scores that are in the back of the pattern tool. So we're weighting new infections and new cases of clinical mastitis, and we're trying to come up with a basic pattern. Over on the left there is this herd's predominant pattern, and I say predominant. Are we predominantly a contagious mastitis pattern? Are we predominantly an environmental mastitis pattern during the dry period, or are we predominantly an environmental mastitis pattern in lactation? And as you can see here, the pattern tool is giving us a score out of 100. Where's the area that we need to concentrate on in the first instance? And in this herd, the weighted score is predominantly an environmental pattern in lactation. Okay, so I appreciate that's a very brief run through. There's plenty more about what the pattern tool is exactly doing on the YouTube video and on the website. I'm going to move on to say, given that we know our predominant pattern, step 2 is therefore to select the right resource material. And what we've tried to do here is saying, for example, in our herd just then, given that we know it's a predominantly environmental mastitis pattern in lactation, so anything about cow-to-cow spread we're not currently interested in, and anything about dry cow management we're not currently interested in, we want some resource material to help us with some ideas about our milking cow environment management. And be that bedding, be that stocking density, be that pre-milking teat disinfection routine, something that will help us. And we can therefore get on with the team and get out on farm and have a think about what we're going to do. And whilst, yes, on the left-hand side, we will get to, to get into the buildings, for example, and the bedding management and the cows, but let's also perhaps get round the table and have a bit of a discussion about what we're going to do, decide on some changes and act on these changes. Because in 3 months' time, we're going to want to do step 3, and we're going to want to get the data again from the milk recording organisation. We're going to want to make sure we've got the last 3 months worth of clinical mastitis data as well. And we're going to want to run the pattern tool again and see, is the pattern changing? Can we review the data, make sure we're still working in the right area? Because there's no point in talking about milking cow cubicle management if we've made some changes, the pattern's changed, and actually 75% of new infections in the last few months are coming out of the dry period. Now we need to change tack a little bit. Okay, so I appreciate that's a bit of a quick run through of the scheme. Apologies if you want to know more. I have to direct you back to the website, but for those of you that are more familiar with this, perhaps now you're starting to use it yourself and using the scheme for your monitoring. We've talked a little bit about this at the meetings so far this year, but just a few examples that might be of interest to you. Perhaps a starting point for a herd with a problem, perhaps part of your red tractor health and performance review, but of course, hopefully as well, our routine mastitis and cell count monitoring. So these 3 areas are where we could use QuarterPRO. I mentioned a starting point for herds with problems. Talking to a herd last week up in Scotland, and I want to make the point here that quite often for vets and advisors on the call and for farmers on the call as well, we go through a period where mastitis is really out of control perhaps, or a real concern for us. What we tend to do first of all is we take samples for bacteriology. We somehow want to know what pathogen is causing us problems, and we get told if we know what the pathogen is, we can control it and we can perhaps advise on how to treat it and that sort of thing. Yes, possibly, If we're going to take some samples for bacteriology, though, please take more than 2. You know, vets and advisors on the call as well. You know, we need to be careful with bacteriology. This is an example submission form. We got 2 samples, and the history is we've got a flare-up of mastitis, and we want to think about treatment. Well, 2 samples is going to be very difficult for us to build any kind of plan around. But also, we've got to move away from treatment, haven't we? This is not about treatment. This is about trying to understand where infections are coming from. But then that's difficult sometimes, isn't it? We send a few samples in, and like this example here, we get 1 E. coli, 1 Staph aureus, and a couple of no growths. What do we do now? Is that environmental because of the E. coli? Is it contagious because of the Staph aureus? Well, of course, we don't know, do we? You know, we've got a few samples. This doesn't help us. If we're going to take samples of bacteriology, like the herd I spoke to last week, take a few. So this herd sent in 20 samples. It's a big herd, but they get into the habit of sampling cases and putting them in the freezer. So if they go through a period where they suddenly get quite a lot, like this herd, they can go to the freezer, pull a load of clinical cases that they've sampled and send them down to the lab. Sampling clinical cases is very effective. You don't need to sample high cell count cows to find things, for example. Sampling clinical cases and storing them for a rainy day. But even here, what do we do with this now? Very well taken samples, cotton wool, surgical spirit, you know, a few squirts of milk into a pot, but we've got a real mixture, haven't we? Lots of gram-positive pathogens, lots of gram-negative pathogens. We've got strep disgalactia, 6 of those. We've got 3 E. coli, 4 strep ubris. We've got a real mixed bag here. We've even got a few other things, real environmental opportunists in some of these cases. It doesn't actually help us make a start, I don't think. It's quite environmental. The strep disgalactia is a bit of an odd one, but it doesn't help me. Why don't I use QuarterPRO? Why don't I say to the client, right, can you send me your milk recording and mastitis data? Yes, they could, all in uniform agri as it happens. Let's run the pattern tool. Let's do step 1 of QuarterPRO. All this nice data about high cell count cows, about clinical mastitis events. Let's look for the pattern. And the pattern is very environmental lactation. So the bacteriology helped me a bit with a very diverse environmental sort of etiology, but I know it's a lactation. So I know now when I speak to herd C, and we had a long chat last week, we focused a lot on environment management of the milking cows because QuarterPRO's helped me make a start. Okay. What about with our red tractor health and performance review? You know, and you know what we're getting at here. A lot of us are doing red tractor at the moment. That section where we have to fill out lameness treatment events, clinical mastitis treatment events, and we get to some sort of end of season review, and we have some recommendations from our vet that says, well, in this case, we're going to monitor the incidence and pay close attention to pre-milking routine. Well, okay, but that's a bit wishy-washy. You know, actually, why don't we use QuarterPRO? Take the data, run the pattern tool. Can we be a bit more precise about some of the recommendations about what's driving these clinical mastitis cases on farm? Let's take you to Glastonbury herd S. Here's their end of season. We ended with 18 cases per 100 cows per year at the end of the sort of calendar year. Very environmental lactation pattern. And I ran QuarterPRO with them up to the end of October. But a real summer bias, actually, we could see seasonal patterns, a real summer bias. And actually, when I dug around in more detail and using a bit of software to take these apart, well, we talked about summer at herd S. How do we mitigate new cases in the summer? So QuarterPRO helped us with a bit more detail for our red tractor review. And it can help us as a starting point for problems. But of course, where it really lives and where I really sort of urge you to use it is for our routine herd health. And we know what the routine visit is like. And here's Martin and I down with Colin Rowland in Somerset. And it's a chance to get together. We finished the PDs with Col, and I've got a bit of paper in my hand. And after the jokes, you know, we're going to somehow get to a bit of discussion. But actually, I'd advise you and hope that you do occasionally sit down round the table. I can't take my Nottingham students out at the moment. Here we are at John Hill's. We try and get round the table with John now and again. Get round the table and have a bit of a discussion with the data about what we're going to do. And that could be preg rates, it could be mobility scores, it could be calf treatments, couldn't it? It could be lots of things. We try and get round the table on a regular basis, but surely we'd include mastitis in this. And actually, here we are with herd F down in Glastonbury. Chris, he has extended the dry cow shed because over a period of time, we could see that our cell count was really driven by dry period infections. So Chris makes some investment in dry cow management. We got the dry cows looking really nice here in this large loose yard. And I can 3 months later run QuarterPRO, run the pattern tool, and show Chris that actually the dry period environment, if you like, contribution to mastitis has reduced. And actually the pattern has changed with Chris, and we've become much more environmental lactation. In other words, we've seen an impact of the change in management that Chris has done, given the dry cows more room, more space, and therefore we've changed the mastitis pattern. And that really bangs the drum for a bit of a sit down with Chris. There he is. You know, we're going to take the milk recording data, take his clinical mastitis data, rerun the pattern tool and say, well, the pattern changed at herd F. We made inroads. We reduced the contribution from dry period infections and made it a much more lactating period origin problem, if you like. So therefore we changed tack and we have a conversation with Chris about perhaps what's going on with the milking cow environment now. And this business of monitoring every 3 months, please do. It is very quick to use QuarterPRO, very quick to use the pattern tool, and very quick to refer to some of this resource material to give us some ideas for our discussion. So lastly then, again conscious of time and perhaps a bit of discussion at the end, let's look ahead. Winter housing. You know, and perhaps how can we use QuarterPRO, and how can I perhaps illustrate things for you using QuarterPRO? If you're an all year round calving herd, if you're an autumn block calving herd, of course we're thinking about milking cows now, aren't we, in winter housing? And if you're a spring block calving herd, talking to one only the other day, where we're thinking about dry cow environment management. What about all year round calving herds? So we're thinking about winter housing, but of course for all year round herds, are we thinking about dry cows and dry period infections, or are we thinking about milking cows and lactating period origin infections? We tend to just assume milking cow housing, don't we? But of course it could well be that dry cow housing is driving this. How do you decide which area? When we sit down and think about the months ahead, how do we decide what we're going to do? If I could share with you a quick example, Tom up in North Wales, herd H this is now, 75 cows, so a relatively small herd. We're averaging nearly 8,000 litres. Here's the calving cows at herd H. Very sort of traditional, seasonally pastured, so everything is out in the summer, everything is in the winter, milking cows and dry cows. Dry cows are run as one mob. Cell counts under pretty decent control. We tend to run around 200,000 or just under. But Tom's worried about lots of clinical cases. So I had a chat with Tom, went up to see him back in the summer. All the clinical mastitis cases are in the diary. They're not in a spreadsheet or in software. So I took pictures on my phone, banged them into a spreadsheet, and Tom and I sat down with the data. We got hold of his CIS milk recording stuff. We got the clinical mastitis. We used the CDL data converter, that free software which generates the data. We took that data, merged the mastitis cases in, and gave it to the pattern tool. And I could say to Tom, well, actually, what we need to be thinking about, Tom, is environmental infections in lactation. And actually, Tom's pattern was a real winter housing one. So it's nothing to do with dry cows, but his winter housing was a real problem for environmental lactation infections. So we could look at this with Tom. We could say, well, here is the housing. Here's the milking cow cubicle environment now. Sand beds. It looks very good. But we could start thinking about, well, the data is telling us that we get a lot of new cases through the winter, and it's a very environmental milking cow pattern. So therefore we've got to focus here. Refer to the resource material, and Tom says, well, I bed with clean sand once a week. And that's unlikely to be frequent enough. We had a talk about I wanted 3 times a week. Tom was happy to do 2. So I'll compromise for now, and we'll go twice a week for now and see what happens, see if the pattern changes. And you can see there, we also talked about ventilation. The ridge gap, which is above us in that picture, was capped, no outflow at all. And the north-facing side, that wall we're looking at, that's where the predominant wind direction comes from. So all that free, fresh air is now excluded because we have a solid wall. So we need to think about some space boarding, and we need to think about the inlet as well as the outlet. And we also talked about some additional space for the cows. We didn't have anything that wasn't a passageway or a feed area, quite narrow, but we had some outside space that we could use. And Tom was quite keen to explore this and gate off an area where the milking cows could loaf into. And we'll see now the crucial months, November, December, January. I'm going to want to get that data off Tom at the end of January and see where we're getting to. In reality, I want it a bit sooner than that. I want to see if we're getting new cases this side of Christmas. What about an autumn calving herd? Those of you on the call that have basically finished calving now, and you're thinking about winter housing, how does QuarterPRO help? How could it help? Because we're thinking about milking cow environment now, aren't we? Definitely between November and March. We might have our early lactation cows in cubicles. We might have them in loose yards, a mixture. Let's use example herd D up in Nottinghamshire. Because before we start, actually, for autumn calving herds on the call, can I challenge you a bit and say, how's your control of dry period infections so far this season? Has your vet or advisor measured this with you? So if you've calved in a heap of cows in August, September and October, I'm assuming, for example, that less than 10% of them calved in with a high cell count at the first test. Has your vet or advisor measured this with you? Have you looked at this? Did you have a good start to the season? Lots of cows calving down with low cell counts, lots of cows calving in and not getting mastitis in the first month, for example. Did you do better than 1 in 12 cows getting mastitis in the first month? Because if you did, well, then you've really started well. And therefore, there's great emphasis on the coming months with winter housing, isn't there? So herd D is a bit like that. They tend to do very well, and this year's no exception. The team up there have done very well in calving down plenty of cows with low cell count that didn't get mastitis in August, September and October. So we look ahead to winter housing. And this is the winter housing for herd D. They're 500 cows. They've actually got an autumn and a spring block calving herd. So the autumn calving group are about 280 cows in the thick end of 300 cubicles. They bed with recycled manure solids, which is quite interesting. Bed daily, raked every milking. We have a talk about covering the slurry separator because it's not covered. We don't tend to know what the dry matter of the recycled manure solids is, which I think is a bit of an issue sometimes. Automatic scrapers, plenty of loafing space outside. They've got access to a big outdoor loafing area and the collecting yard as well between milkings. They've got lots of room, which is good. And you can also see there the roof, can't you? It's a slotted roof. So we got bags of outlet and also we got loads of inlet as well. So ventilation, this shed should ventilate very well, and it does. So therefore, how does it perform? What are we going to think about in the months ahead? So we could take the data for herd D and we could do it for the previous winter, couldn't we? We could say, well, I wonder how we tended to do for November, December, January at the end of January 2020, i.e. the start of this year. How did we perform? And I'd encourage you to do this. The predominant pattern, yes, was environmental lactation, but of course it's going to be because we're not calving anything in November, December, January. The spring lot haven't calved yet, and the autumn lot are done and dusted. So what we actually sometimes do, and I'd encourage you to do this, is use the pattern tool to have a little shufty at the data. Have a little look at the data. So the 3 months ending the 31st of January, there's our new infection rate as measured by cell count. So we did about 7.5% of cows going from low cell count to high cell count. And there's our rate of new clinical cases. We did around 2.5, 12 cows affected with mastitis for every 12 cows that could have got it. So we have some kind of benchmark, don't we? Now, how's this season going to go? What are we going to talk about with the team? Do we talk about things like spikes in new cases? So I took the data and I looked at this in a bit more detail using some extra software. So those of you who might be using the Total Vet software, for example, you can look at these new clinical cases and say, well, October and January, we saw a bit of a spike. But actually, we did very well to control new cases in November, December, Feb, and March. So comparing with last season, why did we get some spikes in the rate of new cases? What are we going to do differently this year? Are we going to bed a bit more often? Are we going to try and look at pre-milking teat disinfection? Are we going to measure the dry matter of the recycled manure solids? What are we going to do to try and slow down new cases this winter? Okay, so that's a bit for autumn calving herds, perhaps using the pattern tool to help you understand how last winter went, to look ahead to what you're going to do differently this winter. I'm conscious of time, and we're coming to the end of the sort of 3/4 of an hour, as it were. So last 5 minutes or so, what about if you're a spring calving herd and you're looking ahead to winter housing? Because now, of course, it's all about dry cows and calving cow management, isn't it? Between December and February, predominantly. How did we do last year? What do we do with our early dry period cows? Are they tending to be in cubicles? What do we do with our close to calving lot? When do they get pushed into the loose yards? Are we calving cows in a separate loose yard, or is it the same loose yard as the late dry cows? And let's have an example. This is herd E in Leicestershire. But again, before we start, herd E, how was the control of dry period infections last season? So spring calving herds, now's the time to be thinking about this, isn't it? You're coming up to thinking about drying off in a few weeks' time. Do we know how February, March, April 2020 went? How did we do last season? Has your vet or advisor measured this with you? Have you got your data with them and how to think? Because now's the time to think about adjusting management accordingly. So let's take you to herd E for a minute in Leicestershire. We talk about the rugby a lot, so probably a good thing. I can't actually go to herd E generally at the moment because I'm a Welshman, so I'll get all sorts of stick. So herd E is 500 cows, calving February and March, averaging 6,500 litres. Everything is held on an on-farm database, so they've got everything in uniform agri, very organised, this lot. All cows dried off with an internal teat sealant, and any spring block calving herds on the call, if you're not using internal teat sealants, please use internal teat sealants now when you're drying off. Herd E, everything gets a sealant. And then what herd E does is they milk record about 5 times a year. And what they do is they make sure that 3 of those recordings are in September, October, and November. And then they do a 4th recording in March and a 5th recording in April, usually. But they make sure they've got 3 recordings, September, October, November, because they want to find any cows that are above 200,000, because they're going to get antibiotic dry cow, because they're more likely to be infected. So they're doing selective antibiotic dry cow therapy. The early dry cows are in this accommodation you can see here, nice, smart, new wooden kennel cubicle accommodation, bedded with deep sand, looks really nice actually. And then the calving cows are managed in a loose yard bedded with straw. If you measure it up, they get about 6 square meters per cow. They're putting in clean straw every day, and they completely clean out the yard every 2 weeks. They've got a bit of extra space using an empty silage pit adjacent to the loose yard. Try and give them a little bit more room off the yard. And if we take their data and use the pattern tool for herd E, this is the 3 months ending the 30th of April, and we can see what they achieved. And we can use the pattern tool like this. Really low cell count. You can see there at the top of that green column, average the cell count less than 100. Dry period new infection rate, just where my mouse is here, 8%. That's saying only 8% of the cows that were dried off low cell count calved back in with a high cell count in March or April. Really, really good control, the sorts of metrics you'd want to measure. And actually so much so that by the time we got to the end of April, the predominant pattern was actually an environmental lactation pattern. The contribution from the dry period was really small. We'd calved in all those cows and held down the contribution from environmental dry period infection really well, which can be a real challenge in spring block calving herds. So of course we try and think about what they've done, because we've got to do it again this year. So we'll have a little chat with the team before Christmas probably. Here's their yard, is some of the Nottingham students pacing out the bedded area. But just to give you some idea, at the March recording, they had 156 cows and heifers that were within a month after calving on the 25th of March. Only 12 of those cows were measured with a cell count above 200. That's really, really good. And I challenge any spring block calving herds on the call, please measure this yourselves. And can you do this? It is possible, because herd E has done it, but it's possible to do this. Are you achieving this? Of these 156 cows and heifers, 22 cows were cows we knew we dried off high cell count. So of course we're trying to get those better, aren't we, with a bit of antibiotic as well as the sealant. 99 of them were cows we know we dried off low cell count, and 35 of them were first calving heifers. And these are the sorts of things that please do measure, and QuarterPRO will help because it's doing it automatically for you, the pattern tool. But you can get to these numbers in the pattern tool. We can see what the dry period cure rate was. We can see what the dry period new infection rate was. And actually in this herd, only 4 of our 99 cows calved in with a high cell count in March. That's amazingly good. So the challenge is for herd E to do it again, and with the sorts of management they've got in place around the bedding, the loose yards, the sand cubicles, a bit of extra space to take the pressure off the yard, the frequency of mucking out that yard in between calvings. So final thoughts then to bring it together before I hand back to James. In summary, and I appreciate there's a fair bit there we talked through, but I tried to do 3 bits. QuarterPRO allows you to rapidly assess the mastitis pattern on farm. We provide a bit of resource material, and a lot of these resources were taken from the original mastitis control plan, some snippets from research on what we think is very effective. So if your predominant pattern is one of environmental lactation origin infection, for example, well then you grab the environmental lactation resource material and pick a few bits out that you could try in your herd. And it's very easily accessible. Some easy downloads, get your vet and your advisor to help you, and use it as a starting point for mastitis control. And please do use QuarterPRO. Like I said, if you've got a mastitis problem now, yes, take some samples for bacteriology for sure, but run the pattern tool as well. If it's time to do red tractor, run the pattern tool, think about using QuarterPRO to illustrate, if you like, what's going on with mastitis and give you some ideas for recommendations. And that's very much a plea to vets on the call as well. Please do use QuarterPRO with red tractor. It's very quick and easy to do. But also, really where we want QuarterPRO is every 3 months. Regular herd health work with your vet and advisor. Every 3 months, they should be helping you download your milk recording data, getting the mastitis event data with that, and seeing if the pattern for mastitis is changing based on what we're trying to implement. And do it now as we consider the next few months and winter housing. Let's have a think about spring block calving herds. How did you do last winter? What are you going to do different now? Autumn block calving herds, assuming you've done all right out the dry period, well, let's think about winter housing. How did you do last winter? And all year round calving herds, how's it been going in the last few months? What are we going to do in the next few months? So we've run through a few of these things, and the appropriate resource material will help you understand some of these things, but we've got to have some measured outcomes, haven't you? It's all about new cases of mastitis. It's all about new high cell count cows, and can we slow those down? Okay, thank you very much to Andrew and Martin, particularly, who had the original concept and development. Thank you on the right-hand side with the testing and design from QMMS Summit, Nottingham, the Mastitis Control Plan Steering Group, and Derek at AHDB in particular. Thank you very much to all those people, and I'll hand back to James.
Thank you very much, James. A lot, as usual, a lot of useful information there. James mentioned on numerous occasions resources that AHDB Dairy can provide to help you with any problems that come up specifically to mastitis. A couple of good YouTube clips that James has also referred to, how to select cows for dry cow therapy using mastitis records, and also another one, how to correctly administer sealant and antibiotics. And alongside the other resources that we've got, I'd really recommend that you have a look at those two YouTube clips. But James, a question. Obviously, the benefits of using QuarterPRO are undeniable, but it really depends on the information that a farmer's got to put in there. What would you suggest or recommend, or what are the options out there for somebody who's not using a milk recording organisation, perhaps isn't just recording clinical data? What would you suggest to them?
Yeah, okay, so for people on the call that are not milk recording, you can still use QuarterPRO. We can still use the pattern tool. We can manually enter things into the spreadsheet. So you don't need the CDL data converter, because we haven't got any milk recording data to convert. So we just download the pattern tool itself, and we can open up the pattern tool and key in. What you do need is your bulk cell count. So you need to key in your average bulk cell count for the last 3 months, and the 3 months before that, and the 3 months before that. And then we would need to get the clinical mastitis events. And again, your vet and advisor would have to help you with some sort of idea of how many clinical cases of mastitis happen to cows that are less than a month calved. A very quick way of doing this is, if you haven't got software on farm, and we're obviously not milk recording, so we can't report this data to the milk recorder, is write down the next 12 cows that are due to calve, and then put a tick next to them if they get mastitis in the first month. And the aim is that for every 12 cows you calve, less than one should get mastitis in the first 30 days. So you can get some idea of mastitis events in the first month, and we can type that into the pattern tool. But I mean, essentially, as you can understand, it then becomes quite difficult in the absence of individual cow cell count data, and in the absence of electronic clinical mastitis data. We end up kind of scratching around a little bit, you know, and the whole mastitis control, the whole QuarterPRO scheme, we've got to make sure we're targeting our control measures. Otherwise, we just end up making knee-jerk changes. I'll change the dip, I'll change the bedding, I'll throw this at the cows, I'll knock a hole in the wall. You know, I don't really know what I'm doing, because I don't know where most new infections are coming from. But in answer to your question, James, you can use the pattern tool in a very basic way by typing in bulk cell count and having an idea about mastitis cases in the first month.
And for someone that's perhaps not milk recording, James, I mean, I don't want to phrase the question in a way that what can they get away with, because it's, you know, the more information we've got, the better. But, you know, how frequently would you suggest someone's got to milk record to have that meaningful information?
It depends who that someone is. So if it's a spring block calving herd, I absolutely understand that spring block calving herds may not wish to milk record every month, but that's fine. But if they're milk recording 4 times a year, because this seems to be in vogue, doesn't it? Milk record 4 times a year. It's pointless doing it March, June, you know, September, because if we're gonna have a few milk recordings, then do it just before drying off and do it just after calving. So if you're a spring block calving herd, sort of nest these milk recordings so you can make some decisions about dry cow therapy, and we know who is and isn't infected at the end of the season, and then do some milk recordings, particularly in March. Don't leave it till you've calved everything in. We need it after you've calved in a big lump, and we've got a lot of cows in the first 30 days. Similarly, if you're an autumn calving herd, if you calve in a lot of cows in August, September, October, we'll then do a few milk recordings as they're calving in and do a few milk recordings before you dry them off. Of course, if you're an all year round calving herd, you kind of need to do it reasonably often. And if you don't want to do it monthly, at least do it every 6 to 8 weeks. Doing it less often than every couple of months becomes very difficult to track cows.
Okay. Thank you, James. And again, thank you for today. Lots of useful information.
Pleasure.
If there are any autumn block calvers that are on the call listening at the moment, or indeed that are perhaps listening to the recording that want to join an impact group next week with the two of us and our strategic dairy farmer in Cumbria, Adrian Bland, please do let us know. Adrian had a meeting with us a couple of weeks ago online, and would just like to look into a couple of their problems they're experiencing with mastitis in a bit more detail. Thanks everyone for sorry, we've just had one more question come in.
Yeah.
James,
yeah.
you okay to just before I do wrap up?
Yes.
Which is best to upload into QuarterPRO, uniform data or CIS data?
Okay, so the short answer is either. So, but it depends. So your CIS milk recording data, if all your clinical mastitis events are on it as well, then you can download the CDL from CIS. You can convert that using the free CDL converter software, and then you can put that straight in the pattern tool. That would be the easiest way for you. If you're using Uniform Agri, well, then you'll need to either going to extract the mastitis events out of it and do something with the CIS data as well, or you're going to need to get your vet involved to get everything out of Uniform Agri in one go. So the easiest way to do it is to get your CDL from CIS and convert that.
And again, if you need any help sort of converting that into the QuarterPRO tool, please give us a call and we can certainly talk you through it.
We can certainly help you with that. So yeah, please do get in touch if you're having trouble. Yeah.
All that leaves me to say is thanks everyone for joining us today. And also thank you to those people that are watching the recording. As we've said numerous times, there's recordings from all our previous webinars, along with this one today, on our YouTube channel. And also have a look at the podcasts that AHDB Dairy and the wider sectors within AHDB are producing on your podcast provider. But thanks again, everyone, for today. Hope you're all keeping safe and look forward to seeing you all again soon. Goodbye.